member for Mallee, who's just walked in. Perfect timing.
Thank you, Deputy Speaker. Before I begin speaking on the health legislation amendment, Improved Medicare Integrity and Other Measures Bill 2024, I have to call out the emotive, manipulative spin Labor uses in the health portfolio when this bill and Labor's track record demonstrates the outcomes do not match the pre-election rhetoric. Those of us on this side of the House believe in outcomes rather than spin. Labor's rhetoric about saving Medicare and celebrating anniversaries is desperate when you compare actual outcomes, because their record is not good. Not only do they keep the Department of Health under the thumb and unable to provide us or the public data on outcomes, they manipulate departmental resources to claim bulk billing rates are improving. They are not. GP bulk billing has fallen 11% under the Albanese government to 77%, while out-of-pocket costs have increased by 11%, and that is just in the past year alone. To put this into perspective, the GP bulk billing rate rose under Peter Dutton, the Leader of the Opposition, as Health Minister to 84%, and it continued to rise under the former coalition government to 88% before we left office. Under the Albanese government, Medicare is currently covering the lowest percentage of GP fees on record. On average, Australians are being forced to cover 45% more of the cost to see a doctor from their own pocket, in comparison to under the former coalition government. Labor loves talking about when Mr. Dutton was the Health Minister, but they don't like to talk about those facts, Deputy Speaker. This bill implements measures intended to protect the integrity of Medicare, enhance the regulation of goods under the Therapeutic Goods Act, and amend the Tobacco Act. Some amendments in the bill form part of the response to the recommendations of the Independent Review of Medicare Integrity and Compliance undertaken by Dr. Pradeep Philip. The Philip Review identified potential improvements to administering health benefit schemes, in particular, the power to detect, respond to, investigate, disclose, and deter misconduct, fraud, and non-compliance. The bill seeks to address a range of impediments to the department conducting efficient, timely, and effective compliance activities. Given the widespread implications of this bill, the Coalition is seeking further scrutiny of its effect and implications through a Senate inquiry. While we support measures to strengthen the effective administration of Australia's important health benefit schemes, including the Medicare Benefit Schedule, the Pharmaceutical Benefits Scheme, and the Child Dental Benefit Schedule, we want to make sure that there are no unidentified negative consequences created by this bill for Australia's healthcare professionals. It is rather ironic that this legislation aims to make efficiencies in the way Medicare works and improve its integrity, yet under this government, wait times for Australians trying to access vital health services through Service Australia have blown out dramatically, with Australians waiting almost 3 times as long for PBS patient refunds to be processed. Now, who would have thought it? This Labor government is excellent with the headlines, but not so great on the implementation. They're great at beating their chests and 2-word slogans with the word Medicare in it, but not great at beating the delays and delivery of Medicare-funded services to needy Australians, especially in the regions. New data obtained by the opposition through Senate estimates reveals a massive spike in the time it took for the agency to process key health claims during a cost of living crisis. The new data also shows that more health claims in 2023-24 were completed outside the agency's own internal timeliness standard than not, with 8.3 million completed after the official deadline, compared with 5.5 million claims completed on time. At that level, you could excuse Australians for thinking that under Labor, waiting inordinate time for outcomes is the norm. 77% of all bulk billing claims were completed past their official deadline in 23-24, the second worst result across Services Australia's entire health work program. Now, more than ever before, it is critical that the government ensures Australians can have their Medicare and PBS claims paid on time, but instead they have sent the system backwards. Residents in my electorate of Mallee have not seen improvements to Medicare under this government. Labor promised to strengthen Medicare, but they have weakened it. It has never been harder or more expensive to see a doctor than under the Albanese Labor government. Bulk billing rates are falling and the cost of seeing a doctor is rising. The bulk billing data I gave earlier points to a primary care system at crisis point. When primary care becomes unaffordable, difficult decisions must be made in families, households, and by individuals regarding how to spend their limited resources. Australians are making the trade-off between paying their bills and seeing their doctor. Under the Albanese government, health costs have gone up 10%. We know that 1.5 million Australians avoided going to a GP in 2023-24 due to cost concerns. The proportion of people who reported that cost was a reason for delaying or not seeing a GP when needed increased to 8.8% in 23-24 from 7% in 22-23. This is not only a concern in and of itself, but also because people who do not receive the primary care they need in a timely manner often become sicker and need to access the hospital system, including overburdened emergency departments when their symptoms become more severe. This is not good for patients and is costly for the health system. These circumstances are amplified in the regions where the primary care system has long been stretched and is now approaching breaking point. People living in the regions, including in my electorate of Mallee, already have reduced access to primary care, rely more heavily on emergency departments, and are admitted to hospital at a greater rate than those living in major cities. Worse still, those emergency departments are a long distance from where rural, remote and regional Australians live. Earlier this sitting fortnight, I visited the Care Flight helicopter that landed in the Federation Mall promoting their work. Medical evacuation to capital cities for emergency treatment has become the norm in rural, regional and remote Australia. A 2023 report published by consulting firm News clearly articulated the relationship between Medicare benefits schedule, MBS expenditure, emergency department ED presentations, and hospital separations. MBS expenditure reduces the more geographically remote you go, and in concert, ED and acute hospital usage increases. When this existing system strain is coupled with the degradation that is occurring under the Albanese government, the outcome is magnified. People in the regions are really doing it tough when it comes to getting the primary care they need and deserve, and this government has not done them any favours. The Australian Bureau of Statistics data corroborates this finding, illustrating that people living in outer regional, remote and very remote areas were more likely to report waiting longer than they felt acceptable for a GP appointment in 23-24 than those living in major cities, 36.3% compared to 26%. They were also less likely to see an after-hours GP, 5.6% compared to 3.9%, and more likely to visit a hospital ED, 20.4% compared to 13.8%, or be admitted to hospital, 14.2% compared to 12.1%. Constituents regularly tell me of the significant challenges they face just getting to see a doctor. Here are some of their comments. There are no GPs in my town. The nearest is 70 kilometres away. Our previous clinic closed and it took 6 months to find a new GP clinic that would accept new patients. My family now has 3 different clinics between us, but we still do not have access to a regular doctor because they keep leaving town. The last doctor I was seeing left the nearest town. Now there are none taking new patients, so I see locums in a town further away. All Australians should be able to access the care of a GP when they need one. Yet under the Albanese government, this is becoming a pipe dream for a few. There are just not enough GPs in the regions. This long-standing workforce crisis was amplified thanks to Labor bleeding the regions of doctors through the expansion of the distribution priority area, which funneled international medical graduates into peri-urban settings. There is a significant and persistent maldistribution of the GP workforce, resulting in shortages in the regions, especially in small rural towns. And I have 72 in Mallee. We know that small rural towns like Dimboola in my electorate, for example, have on average almost 60% fewer health professionals than major cities. Just imagine. As older GPs retire, more young GPs are required to replace them as they're no longer willing to work the kind of hours that were required in the past. One retiring GP might require 2 or even 3 younger GPs to cover their workload into the future. And then there is the issue of supervision. Younger GPs are pushing back against the requirement to supervise trainee GPs in their practices. And I have some in Mildura in exactly that position, in part because they are just not remunerated adequately for the time and energy involved to train the next generation of doctors to a high standard. It also takes them out of seeing their own patients. If you have a level 1 registrar, it requires every appointment for the GP, the supervisor, to sit with that registrar. It's a requirement, it's needed, but the remuneration is not there to match the workload. That is not to mention, as time doesn't permit, the woeful approval times at APRA on this government's watch to get doctors up and running, practicing here, which at times, as it did in Maryborough last year, leave our health services desperately short. These are key issues which must be addressed to make it easier for people in the regions to see a doctor. Yet this government has been moving the dial in the wrong direction. And I haven't even touched on the challenges posed by the higher costs of running a GP practice in the regions, including to fund locum doctors or incentivise GPs to move to an area by reimbursing relocation costs and providing subsidised housing. And all this coupled with patient populations who have lower incomes on average and therefore reduced ability to pay out-of-pocket costs.